Diabetes in Ayurvedic perspective. India will have maximum number of diabetic patients by the year 2025. So it is rather a shameful prediction which India has to face. Unfortunately, nobody is trying to disapprove this prediction. How should we disprove it? Of course, it is a Herculean task, but with firm determination and action, we can do it. Hetu, causes. The main reasons behind the spread of disease are heredity, sedentary lifestyle, lack of exercise and yoga, stress, and improper diet habits. In order to prevent the primary onset, we need to concentrate on the next generation of the existing diabetic patients. Making them aware would be the first task, followed by provocation for an action, followed by action in reality. The Ayurvedic texts describe 20 types of prameha. Out of this 20, 10 are due to kapha dosh, 6 are due to pitta dosh, and 4 are due to vata dosh. In the absence of heredity, the prameha caused by kapha dosh is curable. If it is hereditary, it has to be maintained throughout the life. Pittaja and vataja prameha also need to be maintained throughout the life, prohibiting their complications. Here we consider the factors like hetu, cause, purvaroop, pre-symptoms, elaborately for the disease. The major reasons as mentioned have to be considered in detail. 1. Heredity. The young generation should undergo panchakarma followed by rasayan treatment. This will help them at least to prohibit or prolong the primary onset of the disease. If this is done before conception, their children will have the same benefit, at least the prolongation of the primary onset. Besides, they should improve upon their lifestyle so as to delay the primary onset of disease. Other factors, especially addictions, have to be taken care of. If already addicted, one should get de-addicted. 2. Sedentary lifestyle. A regular exercise, at least in the form of walk, is a must for sedentary lifestyle. Even pranayama in the form of Kapalbhati Bhasrika is most beneficial. One may opt for regular sport, but some physical exercise is needed anyway. 3. Stress. Proper thinking is required to avoid the stress. One should understand own capacities, accept the situation which is not changeable, look for new avenues using own capacities, and try to come out of the situation in a positive way. A counselor can give tailor-made suggestions to help the people. Yoga helps for firm determination and making one introvert. 4. Improper diet habits. There are controversies regarding the concept of diet in prameha in Ayurvedic perspective and that of diabetes mellitus in modern medicine. Especially curd or yogurt and preparations from black grams like idli, dosa are not allowed according to Ayurved, but these are recommended in modern medicine. This is one of the reasons for kidney failure, a common complication of diabetes. Drinking excessive water is not permissible according to Ayurved, especially in prameha. But due to wrong notions, people keep on drinking excessive water, resulting in pressure on kidneys, leading to swelling and further to kidney failure. Use of tomatoes has also increased in our daily diet. Tomatoes are used in curries, vegetables, salads, sauces, soups, etc. This is also one of the causes leading towards kidney failure. So tomatoes should be used very sparingly. Karela, bitter gourd, and methi, fenugreek leaves, seeds are bitter substances. In order to reduce or control blood sugar levels, these are helpful to certain extent. One should consume them regularly in a limited quantity, but excess use leads to loss of weight, imbalance of vata dosh. Excessive use like one glass of bitter gourd juice daily for months should be avoided. Sweets are generally avoided by diabetic patients. One may not eat sugar or jaggery directly, but little quantity of it in vegetable and curries is permissible if the sugar level is well controlled. Sometimes it is also seen that irrespective of increasing the dose of anti-diabetic drugs, either in tablet form or in the insulin, the blood sugar keeps on rising. This is a reactionary rise because the body needs sugar and the sugar is restricted, or with the high dosage of anti-diabetic drugs we reduce the sugar levels. The body starts producing it in more quantities. This condition is due to severe apatarpana, un- undernourishment. Undernourishment may be even due to stress of the body. The dose of anti-diabetic drugs are to be reduced and sugar is to be given orally. I have experienced that in spite of giving additional sugar and reducing drugs, the blood sugar level drops down and becomes normal. Excessive fasting also leads to such condition. If there is fear of hypoglycemia, one should reduce the dose of anti-diabetic drugs in consultation with the doctors. Pickles and spices are especially a cause of diabetic retinopathy. One should avoid them. Pickle made from turmeric and emlica is admissible to a certain extent. Excessive use of salt also leads to retinopathy. One should reduce it. Rock salt is a better option to sea salt for regular use. It is better to keep rice restricted. It can be roasted before cooking. Other cereals may also be roasted and then used. Barley is also good once a day during daytime. It is good for obesity and diabetes both. Anger, stress, anxiety, depression are also causes for aggravation of the disease, producing more complications like retinopathy, CRF, etc. They should be avoided. Purvaroop, pre-symptoms. Increase in mala, waste product during the formation of dhatu in the oral cavity, leading to foul smell and discoloration of teeth. Burning sensation of soles of hands and feet, a kind of sticky feeling in the body, excessive thirst and sweet taste in the mouth are the pre-symptoms of prameha. If they are noticed, one should immediately consult a physician and try to get cured. Other associated symptoms are loss in weight, gain in weight, fatigue. Roop symptom. Frequency of urine with more quantity of urine each time is the main symptom. This is observed during the night time as well. So the person has to get up during night for urination. A person becomes lazier and prefers to sit in case he is standing or walking, and prefers to sleep if he is sitting. Ants are attracted towards the urine. As such, the whole body has a kind of sweet taste. Hence, it is also called as madhumeha. Madhu means honey and meha means urination. Upashaya, relieving factors. It is very well observed that regular exercise like walking gives relief both symptomatically and in pathological investigation. Relieving stress also gives good results. Anupashay, aggravating factors. Lack of exercise, yoga, stress and depression, improper food habits do aggravate the disease. Samprapti, creation of the disease starting from the imbalanced state of dosh. One has to consider various aspects about the person at an individual level and then understand the course of disease and its manifestations. Then, holistic management can be applied. Complications of diabetes. Most of the diabetic patients are on anti-diabetic oral drugs or insulin today. The blood sugar level is thus maintained in most of them. But these drugs do not prohibit the complications of the disease. In spite of a well-controlled blood sugar level, these complications keep on progressing silently in the body. Improper lifestyle and food habits, stress, anger, depression, lack of exercise, addictions, etc. are the reasons for the complications. One has to search and counteract them to prohibit or at least prolong the onset of these, or to get rid of them if already suffering from them. A. Diabetic nephropathy. As regards nephropathy, the diet according to Ayurved and modern science is contradictory to each other. Especially curds or yogurts, black gram preparations like idli, dosa, etc. are contraindicated in diabetes according to Ayurved, but these are recommended by modern dietitians. Moreover, according to Ayurved, even a healthy person has to drink the minimum amount of water daily, 1000 to 1200 ml. The diabetic patients all should strictly follow this rule, but unfortunately, due to the wrong campaign of drinking plenty of water, people suffering from diabetes also start drinking plenty of water and a result start getting swelling over the feet. Curd or black gram also contributes to that. As a result, people start getting swelling over feet, face, etc. The patients are then given diuretics, which instantaneously reduce the swelling. But then this produces more thirst. As a result, the patients drink more water along with continuation of consumption of curds and black gram preparations. This sets a vicious circle. Consumption of causative factors followed by swelling followed by diuretes, again more water, etc. Now the kidney function gets affected and albumin or protein is excreted through urine. At least one should become aware and try to prohibit further process. If it continues, the blood urea and serum creatinine start increasing, and one fine day the patient is advised to get the fistula done, as he or she may require dialysis anytime. At this stage also, the disease is either reversible or at least maintainable. But once the patient switches over to lifetime dialysis or kidney transplant, it's very difficult to help. So it is better to take proper care at proper times. Dialysis or kidney transplant is a mechanical device and not actually a treatment. Moreover, it is too expensive and troublesome to the patient. B. Diabetic retinopathy. The causes like consumption of more salt, putting extra salt in substances, salty items like pickles, biscuits, cashews, peanuts, cheese, etc., more acidic food, curds, buttermilk, pickles, fermented food, tomatoes, unripe mango, etc., anger, stress, depression, etc., lead to retinopathy, leading further to blindness if untreated. The lesser treatment offered for this is ineffective in many cases and doesn't go to the root cause. It is better to prevent this complication rather than treating it. Diabetic neuropathy, especially the starvation or reduction of fat like oils and ghee in the diet, stress or worry lead to imbalanced state of Vata dosh, causing neuropathy. There is unbearable pain, especially in the legs, dryness of the skin and black coloration. One has to start using ghee and oil in the diet. Oil massage followed by fomentation is also beneficial. Stress and worries have to be taken care of through counseling, yoga, etc. D. Diabetic gangrene. Due to the end arthritis and diabetes, the circulation towards the end parts of the body like fingers of hands or feet gets hampered. As a result, the parts start dying and they turn black. The dry gangrene is a time-taking process and can be reverted or at least stopped. Amputation can be avoided through holistic Ayurvedic management. Massage also helps in this condition. E. Diabetic foot. Some diabetic patients suffer from this complication. There is ulceration in foot and they don't heal in proper time. Rigorous treatment and care is required in this condition and one should never neglect it. Treatment of diabetes. Considering the heredity, the prolonged illness, holistic management is required throughout the life. There is a large population suffering from diabetes and is on anti-diabetic drugs. They are under the impression that they have kept diabetes under control, but in reality is not so. These drugs control the blood sugar level, but irrespective of its control, diabetes continues with this complication and those are known only at the very late stage. Hence, it is utmost necessary to maintain a healthy lifestyle throughout the life. Panchakarma treatment, especially Vamana and Virechana, is most useful in diabetes. Varieties of medicines have been described by the texts. One may seek help from Ayurvedic physician for proper Ayurvedic treatment. Turmeric and Emblica fruit powder is an important yet simple Ayurvedic medication which can be taken by any patient. However, it is recommended that proper Ayurvedic treatment from an Ayurvedic physician is taken. The website www.gadgilayurved.com provides guidance for prevention and treatment of diabetes and its complications. Full-fledged Ayurvedic treatment for diabetes and or its complications like kidney failure, CRF, retinopathy, etc. is available in my clinics and in the clinics of the service providers listed under mapping of services one may contact directly in the clinics.